RSV is respiratory syncytial virus, which is a common respiratory virus that causes infection in a lot of people. Every winter, we see a lot of people infected with RSV. And for a lot of people, the symptoms are really more the symptoms of a regular cold, cough, sneezing, congestion, runny nose, fevers, things like that. For some people, which includes really young patients, and also for people with underlying health conditions, RSV can be much more serious and results in a lot of hospitalizations every year, especially of infants and children who have underlying health conditions. Over the course of the last couple of years, the public health preventive measures that we've taken against COVID have also been really successful at limiting other respiratory viruses. What that means is we have a population that really hasn't seen these respiratory viruses for several years and therefore hasn't built up the same immunity that we normally see. So instead of having a population where a majority of people saw RSV last year, we now have a lot of younger children that have never seen RSV. And as a result, we're seeing more children who are getting sicker with RSV than we do in a regular season. Most RSV infections will go away on their own in a week or two, and the care is really primarily supportive care, which includes proper feeding and hydration, getting appropriate sleep, and keeping control of fever and pain. There are some children who are at risk for developing more severe symptoms. And if you are concerned that your child's exhibiting any of these symptoms, please reach out to your pediatrician or your healthcare provider. So the best way to try to keep your children safe from a viral infection is to practice many of the same things that we've been doing against COVID over the course of the last several years. Frequent hand washing is really important, trying to stay away from people who are sick, paying attention to surfaces that might be dirty and making sure to clean and disinfect those is helpful. Being up to date on vaccines is always a good idea, including flu and COVID-19 vaccines. And then limiting large gatherings of people and considering mask usage in certain situations, all of those are things that might really help to decrease your child's chance of getting RSV.